Your first question is, can we use any antibiotic ointment or a specific one? Uh, I don't know about which type of infection you are talking about. I told you any antibacterial ointment or it depends upon the condition of the wound. Uh, if wound is very contaminated, you must be irrigate the wound first with normal saline, irrigate the wound, and if dead tissues are there, you must debride the wound, remove the dead and devitalized tissue from that wound. That can be done under GA if the wound is large. If the wound is small, you can use local anesthesia or regional anesthesia. But this can be done at clinic, which is very well equipped, or a hospital in which all the facilities are there in the operation theater under the supervision of a surgeon, or a surgeon can do all these things. Clean the wound first and then debride it if dead tissues are there, and then you can apply the antibacterial ointment. The most popularly used ointment is the Polyfex, polymyxin B ointment, Polyfex, by the name of Polyfex. It is available in the market. You can use the Polyfex over the wound. It depends which type of wound, and if uh, as far as the antibacterial ointment is concerned, you must send first the pus CS, the contaminated material from the pus. You must send for culture and sensitivity in order to get the clue about the organism, and the appropriate oral antibiotic you can start after the report of that pus CS. You can use topical antibacterial and as well as the oral antibiotic. Then you can get good results. And as far as your question is concerned about the use of antibiotic ointment, Polyfex is the most widely used and very effective ointment still. And the other one is the pyodine gel, not the solution. Always remember, solution is something different. Pyodine gel you can use directly onto the wound. It covers the gram-positive organisms, it kills the gram-negative organisms, and it also kills the fungus if present on the wound. It is very good topical antibacterial ointment. And after Polyfex, polymyxin B by the name of Polyfex, and pyodine gel you can use as an alternate. Both are very good as a topical antibacterial. And your question number two is how many ways to stop nasal bleeding? I told you number one is the maneuver, by make the patient sit, number one step, and then lean patient forward and pinch the nose, nostrils, lower part of the nose as called as nostrils, with the index and thumb finger, with the index finger and thumb. By these two, pinch the finger, pinch the nose, lower part of the nose, that is called as L of the nose. You must pinch the nose with thumb and index finger. Make the patient sit, lean forward, and advise the patient to breathe from the mouth. Okay. And the other is nasal packing that you can do if. One thing you must remember, this pinch of the nose, the maneuver that you are doing, should be for 15 minutes at least. Always remember. If you are doing it for 1 or 3 or 4 minutes, it is useless. Always remember. People, they are in great hurry and they open the nostrils, left the finger pressure and open the nostril, and they start again bleeding. Always remember, for about 15 minutes, you must Apply pressure with the index and thumb finger on the lower part of the nose. Make the patient sit, lean forward. Okay. And the other method is can be done by I think ENT surgeon or a general surgeon or expert person who has a experience of doing all these things. Pack the nose with 1% adrenaline. Adrenaline soaked gauze. Adrenaline is a vasoconstrictor. Adrenaline soaked gauze, but adrenaline must be 1 is to 100, 1 is to 1000. Because if you are, but should be in diluted form. 1 is to 1000 strength adrenaline mixed in 100 ml of normal saline, and that cotton or gauze soaked in that and packed it with this gauze, and it will definitely stop bleeding because adrenaline has got the effect of vasoconstriction. The third is ice or cold water or ice. You can apply ice onto the forehead of the patient from where these vessels are coming down, and by the application of ice, these vessels get constricted, and you can directly apply ice onto the nostril also, but it is not good maneuver. But if you apply it onto the forehead, uh, it will constrict the vessels and bleeding gets stopped. These are the three methods. And the fourth method is that even after all these things, you are not getting the relief and bleeding remain continued. You must take the patient to the hospital where cauterization can be done. The bleeding area is cauterized by instrument called as electric cautery, but this can be done in the hospital. Okay. This was the answer of your second question. And the third question is kindly explain the process of stoppage of nasal bleeding by using cold pack. Yeah, I have told you. This I have told you in your question 2. And the fourth, what's the difference between artery bleeding and venous bleeding? Venous bleeding can be stopped by elevation or pressure. Very easily stopped by elevation or pressure. How can you identify between it is a arterial bleeding or venous? If you want to ask this, the arterial bleeding is bright red, number one, and spotting is there. The blood jumps from the artery to far distance, but in the bleeding of vein, no such things. The blood is only trickle down, not jump. In the arterial bleeding, it is flash. It jumps from the bleeding area for a smaller distance, but it depends upon the diameter of the arteries. Larger arteries there, it may splash far distance or blood jump far distance from that area, or if a small one to a very little area. But uh, the blood from the artery is spurt. It jumps. Jerky movement will be there. You can easily identify. But in venous bleeding, no jerky movement. It just trickle down from the area where the vein is cut and bleeding is start. In venous bleeding, you can easily treat venous bleeding by pressure, applying pressure, number one. Number two, by elevation of that area, as I told you in my first lecture of first aid, or by simple bandage, pressure bandage. You can stop the bleeding by pressure bandage. While in artery, you can stop the bleeding if it is smaller one by pressure bandage, or if you are not successful, then apply a tourniquet proximal to the bleeding area against a bone. Always remember this I very well explained in my first lecture of first aid. If you go through that lecture again, you can get easily your answer of your question. And if even after pressure or after applying tourniquet, you are not getting the success, then the last option is stitching. Apply stitch and entangle the mouth of the artery, bleeding gets stopped. This can be done in the hospital, in the operation theater, by experienced person or a surgeon. Okay, thank you.